Thank you for having me for this presentation. Can you hear me okay? Can you see my slides? Okay,
Yes.
so I'm happy to share with everyone here one of my projects. We are focusing on how we can promote the social resilience for racialized older immigrants in Canada. It's a big name, but mainly our work is in Edmonton and Calgary. We use a stakeholder engagement methods, and it will be a collaborative methods for community members, organizations, and researchers. First of all, I want to acknowledge that I currently live in Edmonton, Alberta, which is in the Treaty 6 territory, and it's also homeland for the Métis Nation Region 4. And this is traditional territory for many indigenous communities and peoples, including Cree, Dene, Saulteaux, Blackfoot, and Stoney. Personally, I am an immigrant from China. I have been living in Canada for 14 years. I usually call myself someone who has been living coast to coast because of the education and the work needs. I have been living in Vancouver to Prince Edward Island. Of course, I always call Edmonton at my home and Calgary my dream city. So, since we have about 40 minutes, and it is a bigger project. I will mainly focusing on the findings that is more practical with daily practice, and also I will share with you lots of stories and experience comes from different stakeholders. First of all, we all know that Canadian population is aging. We have more and more older adults, and also our aging population is more diversified because of the international immigration. And according to our last census in Alberta, more than 40% of immigrants are coming from Philippines, Vietnam, China, and India, and also other African countries. And it is expected that over maybe in 5, 6 years, about 1 in 4 older Canadians will be racialized older adults. However, racialized older immigrants usually experience more social isolation, loneliness than local-born older adults or other older adults who moving from some countries like European countries who can their language, their culture are much similar to the local Canadians. And for example, during the pandemic, there are lots of cases are reported related to racialized older immigrants experience discrimination, increasing isolation, and other health issues. So I have been working in gerontology for a while, and as just being introduced, I come from a social work background. So I do research in gerontology or gerontological social work fields. I learn that it is important to support racialized older immigrants. And one of the most important concepts we use is resilience. It is a capability, skills that can help individual to adapt or bounce back from difficult situations like the pandemic, like in the discrimination situations. And I'm more focusing on social resilience, which is closely related to older adults' capability to maintain or promote their positive social relationship interactions, increasing their social activities, social participations, civic participation, or community engagement. Those things can help them to reduce social isolation, loneliness, and to increase their social capitals. So, based on my understanding of the needs for this social isolation, we design a research that we want to know what is the social resilience among racialized older immigrants in Edmonton. At the beginning, it's in Edmonton, but now we expand to Calgary. So However, the thing is, social resilience is kind of a new concept for many people. So we want to know from different perspectives how people understand social resilience and how we can promote social resilience for racialized older immigrants. So I applied one method called stakeholder engagement methods. We invite older adults, of course, they are the key stakeholder, and service providers who are the frontline workers have interaction with older adults from immigration community, ethnocultural community, different regional community daily, and researchers, how researchers understand this. I'm not going to go through the literature review or theoretical framework. That's too much for different people. So I will just jump to what we have done and what we have found. So my methods of focus group is a little bit different from the traditional focus group. Usually, traditional focus group, we will find individuals from same background, like a group of older adults or a group of service providers. For our focus group, we will find, for example, two older adults, two service providers, one scholars, and of course, I'm a professor in MacEwan University. I want to include students in the program. So we have students, and of course, me and my research assistant. Our focus group, the participants numbers span from 6 to 10, depends on the availability of different stakeholders. And after all the focus group, we also have our workshop, or we can call it networking event. So in our first stage of our program, from the later 2024 to beginning of 2025, we conducted 5 focus groups with 5 different communities. Those communities are the main ethnocultural, regional, or racialized communities with many older adults in Edmonton: Chinese communities, Southeast Asia communities, South Asia communities, Black communities, and Muslim communities. And after that, we have a workshop with multiple stakeholders. I cannot show you the picture for focus group. Actually, we don't take photos for focus group because of the confidentiality issues. But this is a photo for our workshop. We use the title called "Whose Resilience?" We want to discuss when we're talking about resilience, what's the real meaning of it. So I will share some of the essential findings from our project, which of course it's related to
Sorry, Dr. Li, you are muted.
okay, sorry. Um, I will share the results we find from the program. It's about how our stakeholders understand social resilience, and we also discuss what are the existing programs or those needed programs that we need to promote social resilience for older adults. So first of all, when we ask our stakeholders, they are older adults from different communities, they are researchers from different ethnocultural communities, and they are service providers. Many of them are very honest with us. They never heard about social resilience, this concept before. They know resilience because we talk about resilience for our environment, for individual personality characteristics. But what is social resilience? Some of them never heard about it. And with more discussion, our participants believe we can understand the social resilience from 3 levels: from the personal level, community level, and the society's level. So when we ask our participants what is their understanding of social resilience, usually they talk about personal level first. One, those red paragraphs are all conversations from our focus group. So one of our participants said, so when I first heard about it, I'm thinking it's like how you could adjust to the community, right? So get like resources, how your social activities, like your social relationships, something like that. A lot of our participants, when talk about social resilience, they always talk about they come to Edmonton, they come to Canada, how they can know where to find the resources, where to get access to the organizations, to find the communities, find the church, find the Newcomer Center. They think about from their personal perspective. And another participant said, my understanding is this is firstly about a person who has these individual characteristics. In face of any difficulties, situations, he will not collapse. So it is normal that many people think about from the first personal level. And then with more discussion, our participants start to realize maybe social resilience is a community level concept. The first conversation I have listed here is one of our service provider who has been working in Edmonton as service provider for the Filipino community for more than 30 years. She observed that over the past 10 to 15 years, there are more and more organizations coming out to support older adults or other community members because people start to realize community is important. She said, I've never seen so many organizations in the last 10 to 15 years, not just in the Filipino community, but all over. So I'm thinking that's where the resilience comes from. And also, many immigrants, they come from the culture we emphasize groups, communities, rather than families, individuals. So one of the participants mentioned a lot of immigrants come from collectivist culture, meaning we identify ourselves with others, whether it's family or community. And so really, this strong relationship with family and community is really a form, it's a source of resilience. So we start to think about social resilience can be understood from the community level, neighborhood, our culture, our groups, families. And then several participants start to mention the society, the social society as a level that it's important for us to understand the resilience issues. So one of the participants said, to me, social resilience means there's a society, there's a group, and a new person comes in, how they are accepted, how they are welcomed, how they can fit in. So because our focus is about immigrants and about older adults. So this is a really good point that lots of immigrants come to Edmonton, come to Calgary or any place in Canada. How they are accepted, how they can find a place they feel this will be my home. I feel accepted. That is really important. And of course, during the conversation, we talk about lots of the systematic barriers, challenges that all the immigrants face in their daily life after they come to Canada, come to a new place. So our participants, when they talk about the resilience or social resilience, these concepts, it's normal that because resilience concepts are more likely to be used in psychology background. People are more focusing on individual level issues. But when we talk about the social resilience, our participants with um, conversation with recall of their stories, sharing of the experience, they believe social resilience can be understood at different levels. And with more conversation, actually, I can show here, all the three levels are connected together. When we are talking about how we can promote the social resilience for all the immigrants, with different strategies, we will find the three levels are interconnected. So one of the focus of our program is we discuss from all the adults' perspective, service providers' experience, and the researchers or scholars' knowledge creation activities. We want to know how we can promote social resilience for racialized older immigrants. After the focus groups, after the networking event conversation, we believe there should be at least four components of strategies. First, we empower individual older immigrants through different learning opportunities and volunteering activities. We develop awareness of the situation that older immigrants would experience within the family, because family are the first contact they will have. And we also increase community-based programs for them. And at the last, society level change are needed to support racialized older immigrants. So we invite our participants to share their stories. There are a lot, to be honest. So we should provide different learning opportunities to empower our immigrants. The first conversation, our older adults should learn how to make animal balloons in this organization. And she feels so, I would say, motivated to do that because she believes it is important tool to connect to the grandchildren. She come to Canada as a reunion family member. She found that her grandchildren grew up here, speak English, do not know the home country culture, and their relationship is not so good. The moment she feels that her grandchildren want to play with her, yes, she learned how to make animal balloons and show the grandchildren the sword, the flowers she made. And she believed this is very fulfilling moment for her. And also another older adults mentioned that he's from African background. He's been in Edmonton for more than 20 or 30 years. He said they organize this like city tour activities. They took the older adults to the museum, and he talks this in a very interesting way. He said, another place we went, all of the places was a museum. Africans, we hardly go to such places, but when I got them, we went to the museum. They were like, wow, that's really interesting experience, important for those older adults to get connect to those different places of interest, like the museum, like the park. And actually, I also work with another organization in Edmonton. One of the requirement for many older adults for summertime is a field trip. I think I have conversation with some organization in Calgary too. Field trip is really in high demand for older adults during the summertime, because this is a method or tool that we can connect the older adults to the communities, to the city life. Technology, now we cannot afford technology. We need the digital capabilities, literacy for older adults to navigate lots of things. During the pandemic, lots as a researcher, to be honest, as a researcher, as someone sitting in the office a lot, like many people, we assume all the adults would find a challenge to learn the different technologies. But lots of the research from the pandemic show all the adults are very open to learn how to use WhatsApp, Facebook, and using the Google Map system to navigate how to take a bus. Actually, they really like it. And all the adults feel they achieve something when they are able to manage how to take a bus by themselves, how to talk to people in their home country through different social media. And in Edmonton, there's one Chinese group. They use WeChat to organize the daily jogging group, the walking group. They use it as a good platform to organize different activities. Volunteer is one of the main things that many older adults are looking for. However, there are not so many opportunities for them to be a volunteer. Some of our participants, they are volunteers in the service or community organizations, and they believe it's really important for older adults. And some older immigrants, they are volunteers because they believe they can support others. And one of the organization we have in Edmonton is ICANN Senior Association. They are a group. Basically, of course, they have some funding, but they don't have any full-time worker or part-time worker. All the management are run by the volunteers, and they have a huge group of volunteers for dancing class, English class, daily activities, field trip, and they even have a music show for different organizations. So many of our older adults believe volunteer experience can create value for them after they come here, or after they believe they already get integrated into the local society. When we talk about the individual level opportunities, many older adults also talk about their surprise moment in Edmonton. They are like, the snow is so much, it's so cold, yet there are so many things to navigate. And when the conversation will be interesting. So I ask them, before you come to Canada, did your children tell you that it is a colder place? It is a place that we have to navigate different things, and maybe we have to spend lots of time at home by ourselves in winter time. Some of the adults say their children never have the conversation with them. Some children are joking like, she mentions this, but I never take it seriously because they're like, I have been 60 years old. I have seen a lot. What things I haven't seen for so many years. So they underestimate the challenges. So many of the situation is we don't have sufficient preparation at the family level. So one of the participants said, so I think there must be an awareness within the family itself that my parents are going through these challenges. I must be aware so that, I give them kind of support as well. And also, because many of our older adults participants, they come here for one of the main reasons is supporting the grandchildren. I will bring this up later. So many of the first generation of the immigrants, they have a hard life because they have to work hard to settle down. They have children. So to bring the grandparents to support grandchildren is one strategy. For example, Chinese community, Southeast Asia community, or South Asia communities they will use. However, some of the families, they underestimate or they never thought about the mental health issues, the social, physical health challenges. We think it is important for the families to know that. I was interviewing another older adults earlier this week. She come from another country, and she said she attended several webinars last year, so she has a good idea about what's going on. And although after she come here, she still feels the culture shock, and but it's much better than coming here without knowing anything. So we believe some knowledge, some preparation from the first generation immigrants to support their parents before they come here, or at the very beginning, they come here was very important. Community level support is really important. We spend lots of time talk about the community level programs, and some, of course, share what they have done, and other people really like it. So community can be seen as ethnocultural or regional communities. One of the suggestions we have is one of the adults said, I was going to suggest that, if anything happens, like have it, those different programs housed in, like, say, the church communities or community center, something where they can already easily access. Lots of the adults say went to the church, they go to different community centers. So if possible, we can have those programs there. And also, we are able to provide programs in different locations. That would be great because I I think in Calgary you have the African Center. In Edmonton we also have the African Center. The other day I find out that several of the older adults they have to spend 1 hour or even 1 hour and a half to go to the African Center by bus transition to LRT or say train to the African Center, but they still want to go because they believe they can find good programs there and they find they can meet their friends. Some people they want to work with there. Even they spend like 2 to 3 on the road round the trip. And one of our students told us that in Edmonton, there is one church over the weekend. There will be over 1,000 people to go to this church because they have a lot of good programs, activities, and people want to go there. Unfortunately, our students said she just passed by that area for one time. She never had a chance to visit. But another older adult told us she indeed have those programs, but it's very busy. Community can also be seen as a neighborhood, the physical environment. Because, for example, I just mentioned many of the older adults, they come here to support their grandchildren. And one of the, or actually not one, in several different focus group we have, those grandparents, they told us, actually, I have a daughter of 5 years old, so I know playground. So any of you, if you go to playground, you can think about there are lots of kids playing. There are picnic tables, maybe gazebos, but there are not enough sitting areas. Like in my neighborhood, our playground was renovated last year. There was only 2 picnic tables before. Last year, after renovation, we have 3 picnic tables and 1 gazebo with more sitting area. So lots of older adults mention that there are not enough sitting areas for the grandpa grandmas. But this is a good place for those older adults to social with other older adults who come from similar background. They can talk, they can chat. And also, we talk about some service providers told us they actually have very good program. For example, gardening programs. Lots of the older adults come from Africa or Middle East or Chinese communities. They like to do some gardening in summertime. However, there are no sitting area, or those programs are only for older adults. So one of the service providers told us in their neighborhood, they create this gardening program, they create sitting areas, and they also invite the youth or those younger adults to join this gardening program so they can social with the seniors. And intergenerational programs have been brought up a lot. We all know nowadays we have different high school senior home programs or the mixed age programs to invite older adults to teach the younger kids how to cook. And one of the service provider told us that in their African community, they invite older adults to cook the traditional food with younger generation. So this culture or the food, the way to cook the food can pass down to the younger generation. However, another service provider, the second quotation I have here is they are trying to organize this, but she said it didn't happen. I have to admit it didn't happen. They try to get more those intergenerational programs, but I think they need more funding, need more stuff, and also they need more interest from the younger generation. And sometimes it's challenging to make it happen. Of course, after the conversation from personal level, family level, community level, lots of the conversation also lands on the society level. So we think about one of the service community member. She's actually not older adult. She's around 50 years old, and she tried to bring her parents come to Edmonton several years ago, and she tried really hard to take her parents to go to different like the government center to visit, different culture center to visit, to trying to promote the awareness for her parents to learn the life here, the culture here. However, she said it's very challenging for her to do that because she believes there is not sufficient chance to understand the local culture. She tried to promote, but her parents cannot understand English, and there's no those official programs with multiple linguistic person staff to talk to her parents. So unfortunately, because of multiple reasons, her parents decided to return to their home country after 6 months or sometime around that 5 or 6 months. So she heard about our program. Although she's not an older adult, she joined the focus group and she shared good story with us. So we actually later talk about this to another city of Edmonton staff. They want to do more about it. And also something we cannot try to avoid in the discussion or we have to face it is discrimination. It exists in our society. So one of our Black scholar mentions that she also working with Black communities, and one of the things she mentioned, actually she brought a lot, is the discrimination towards certain group of people. And she mentioned that even I'm from social work background, social work program. Even our social work students who from African community doing a practicum in a nursing home. Most of the older adults are local born Caucasian background. They discriminate our students, and many of the situation is those older adults from ethnocultural communities cannot find a good fit, or they find uncomfortable. In another way, they find they are discriminated in those nursing home or some senior centers, so they cannot find the motivation to go there again. Public funding is one issue. During our focus group, we actually have City of Edmonton employees come to join the focus group, and we also have one older adults who have been working with African communities for a long time. He is also trying to find funding, but unfortunately, in the past several years, he told us he only got one funding for like a couple thousand, which is not enough for them to rent a place as center for their group of older adults or to host their senior activities. And he said, but again, you were talking about the funding. The groups here, they are collapsing because of the funding. Like our group had lots of activities, but we are limited in funding. Every time we apply for funding, sometimes we don't get it. Maybe because it's a black group. And one of the not funny consequences is this older adults told us he and the older adults group, like 10 or 15 people, they are close members of this group. Sometimes they go to a bar during the happy hour time because it's affordable for them to find a place to talk. Reduce barriers for racialized older immigrants, language credential recognition. It's a big topic. Actually, I can talk for this topic, I can talk for 1 hour because lots of the time, older immigrants, we can simply different ways to divide them. One way to divide them is those older adults who actually getting older in Edmonton or Canada or Calgary. For example, some of us, we come to Canada when we are 20, 30, or 40 years old. So we get education here, we get a decent job, we have our social networking system here. And another group of older adults come here after retirement. So they come here because their children are here. They want to live with their children to enjoying the retirement with the family. So we have two groups people. However, they both have their own challenges. For older adults who come here as a senior or older immigrants, they have more language barriers. They lose all of their social capital back to their hometown, and they depend on their children's sponsorship. So they relying on the family. Another group who come here as economic worker when we are middle age or come here as a students when we are in 20s. We have different challenges. One of our participants who actually come here when she was in maybe 30s or later 20s, who have been teacher for many years in her home country. He tried to be a teacher in Alberta, but he cannot do that because of the credential issues. Because when he was like 30 years ago, 40 years ago, to survive, to find a job, to raise a family is a more important, the priority in their family. So she actually could not be a full-time student in U of A education program to get the certificate or get the education degree again. So she has never been a teacher, but this motivated her to become a advocate, activist in the community to support the other families, to support the whole communities. So due to the time issue, I will give a brief summary. It's a big project. We have so many fundings, but this is the essential components I want to share with you. Stakeholders, they love to share about social resilience issues. And they also very actively share with us how we can promote social resilience for racialized older immigrants. And also, during the process, collaboration happens. My role is a researcher, a faculty member in a school, but I also want to promote the community collaboration. Like earlier, I mentioned these Black older adults mentioned that they cannot find funding and they do not know how to write grant in certain way. So gladly, one of my MSW students doing practicum with me, she works for the city. So we connect them together and they discuss how they can support them to write the grant, or they will give these older adults and their group more information. And also, I want to be innovative and creative to do the focus group with limited funding. So I trying to bring the different stakeholders together. It's very challenging. I have to admit, the scheduling is killing me. But it's very rewarding because the conversation is really important. And for that 5 focus group, we all host them in our MacEwan campus. At the beginning, some people, and including me, have doubt that we create trouble for all the adults to travel from home to the campus. We should choose the senior center or the organizations they went to activities. It's convenient. However, all the older adults give us the idea that they love it. They want to go to a different place. They want to go to the campus. And they feel lucky they can go to the campus to take a tour or even spend a couple hours there. They feel it's a new experience. And one older adult, he is very interesting, and he said he never talked to a professor before. So we took him around in our School of Social Work office, so say hello to people. He found it very interesting to being in a different place. And I did not stop last summer after we finished the focus group and the workshop. There are many reasons. One of the main reasons is these 2 quotations or these 2 conversations from our participants. Every time I want to read it to my participants and you. One of our participants said, I think sometimes we need to critically think about when we use the word resilience. Whose resilience is it? Who is making the decision that a population is resilient? Yeah, bouncing back and forth. It doesn't mean that somebody is surviving, because there's no survival if you are still experiencing the same problem over and over and over and over. I think it's bounced back and forth, and mostly to vulnerable communities. Another participants in another focus group share similar feelings or thoughts. I keep going back and forth between 2 ways to conceptualize it, because I haven't thought about social resilience. That if resilience is the individual having to overcome and be strong, that is exhausting after a while, right? You are consistently having to be strong, and we see that as a source of pride. Look how strong you are. Look how resilient you are, without thinking of how much energy that takes. So, one way I guess you can understand social resilience is the social is a battery that charges you. That if society just drains you all the time, you cannot be resilient for too long. So, when we talk about the social resilience, how we understand it, we understand it from personal level, community level, society level. When we talk about how we can promote social resilience for all the immigrants, we think about different ways. And when I as someone doing research, doing community collaboration, doing different projects with community members, these 2 quotations really strikes me or enlighten me that we have to do more to support all the immigrants. So last year, after I wrap up that 1-year project, I applied for more funding. I expanded the program to Calgary. This year we are doing it again. Of course, I am still I cannot call myself a junior researcher, but I need someone who I can work with. I also need support. So I talked to one of the experienced researcher in Calgary, Dr. Christine Walsh. We worked together, and we got a fund for officially 2 years, but we can extend it to 3 years. And when I share with this not a new idea, but a new funding with many organizations in Edmonton and Calgary, people like it. So actually in Edmonton this month, we already conducted 4 focus groups, and we will conduct 1 more. And we will do the focus group in Calgary in June. And we got support from Calgary Immigrant Service Calgary. We got support from SEWA. We got the interest from many different organizations in Calgary. So it's a really important project that many people really like it. And we will host the workshop or networking event in later 2026. Thank you for listening to my presentation, and feel free to let me know if you have any questions or you want to share your ideas, your thoughts, your working experience. I think many of you are frontline workers, policymakers. You may have better understanding than me because I usually talk to people and summarize them, but you have the real life experience. If you want to learn more about our project, feel free to Google me with Lun Li, MacEwan University, or you can also send me email. I have my email here, leo53@macewan.ca. I'm going to stop sharing my slides so we can have some discussion time.
Perfect. Thank you so much, Dr. Li. It was eye-opening, very informative sessions. Thank you so much. So everyone, we still have 8 minutes, so feel free to raise your hand if you want to ask directly, or you can also write it in the chat box. Also, I share my screen. If you want, you can scan the QR code, visit our website. You're gonna see Dr. Li email address and his bio as well, so you can communicate with him and also see the upcoming lunch and learn. Let me check the chat. Oh, okay, thank you from the attendees. Yes, it's very important and interesting study. Agree. Because what we usually see it's resilience, as you mentioned, Dr. Li, about from psychological perspective and individual, but your project is more social resilience and working on micro, meso, and macro level on the social level. So very interesting. Actually, I have a question. If no one will ask, besides the funding and lack of resources and barriers to older immigrants, what another barriers you found through the focus group or the workshop?
Yeah, so as I mentioned before, that we are doing focus group with Chinese communities, Southeast Asia communities, South Asia communities, Black and Muslim communities. Actually, I can share this with you that different communities have their different challenges. So, for example, Chinese communities, they are financially decent, but their main challenge comes from the language. Most of Chinese older adults don't speak English. Some of the older adults they can speak Russian because of the historical reason, but they don't speak English, so they don't know how to talk outside of the family. They don't know how to take a bus at the beginning, and they don't know how to talk to the bank stuff. So for Chinese communities, language brought up a lot, and for South Asia community or Southeast Asia community, grandparenting they brought it a lot, and financial issues they brought it a lot. And for Black community, Muslim community, discrimination or racism, those things they brought it a lot. So of course I cannot report them one by one in this presentation, but generally speaking, funding, of course, it's important to provide more service, and also different organizations have different different communities have their own unique challenges. And one of another experience I want to share is I always advocate for more ethnocultural community young adults or younger generation to enroll in different social service, social work programs. Because another challenge many people talk about is we need those service providers who can speak multiple languages, who understand the different cultures, so we can provide culturally appropriate services, or we can provide services in multiple linguistic way. Then it's good for all the adults to feel comfortable to talk to those things, because it's the same thing. When we are doing the focus group, we invite all the adults to speak their home language or speak English, because we have students as volunteers can be the translator. But when all the adults talk about in their home language, they can express their feelings or thoughts really clearly. But when I'm invited some of them to talk the things in English, they're like, I'm shy, I don't know what to talk. So that's the same thing when we provide a service, when we have the organizations. If we can have staff, we can have volunteers who can speak different languages, who know the cultural expectation, cultural practice, it will be great.
Agree. Thank you. Thank you so much, Dr. Li.
Yeah. Hi, Amy. I agree with you that you believe immigrants groups are over-researched and underserved in certain way. Of course, we have lots of research programs and we have lots of projects, and underserved, that's definitely yes. But over-researched, uh, yes, we have lots of programs, but please think things in this way, that still we need more knowledge, we need more people to advocate for the understanding of different things. One of the things is, as someone who are doing the research, I can share with you a reality is I try to find, for example, researchers, scholars work in University of Alberta, University of Calgary, MacEwan Universities, Mountain Royal Universities, who come from those ethnocultural background, who are doing immigration research. It is limited amount of researchers available. So, which means we still need more people to do research. Of course, sometimes we can hear those researchers, but relative rates still limited.
And also the trends is changing, the policies is changing. Yes. So we have 1 minute. Again, thank you so much, Dr. Li, for sharing this finding of great project. And I'm happy also, I saw this project also coming to Calgary, so that's great. Especially we have at Immigrant Service Calgary, great projects supporting the older immigrants. I'm not advertising, but also always love what the heroes are doing. So that's great.
Yeah.
Maybe we can have collaboration on that as well.
Yeah.
Okay, everyone. So if you have any question or anything to share, feel free to email Dr. Li. Thank you, Amy, for sharing the email, and I shared the website on MacEwan University, and wish everyone wonderful rest of the day. Thank you.